Today, frontline mental health workers from OPSEU will be here to call for government action to keep people safe on the job. Workers in the mental health sector are put at risk every day. Hundreds of physical assaults against staff are being reported every year, and that is not okay. Every frontline mental health worker needs to be able to go home safely to their families at the end of their shift. Workers need to know, when will this Liberal government step up and take real steps to prevent violence against workers and patients in the mental health sector?
Well, this conference is the first one we've done, probably the first of its kind. So here the activists are going to learn how to learn more about the Health and Safety Act, the laws that are available to us to protect workers. There's a couple of generations of work done in health and safety, so we'll build on that. Then they're going to learn how to actually go back and hold the employer accountable under the Health and Safety Act. We'll file health and safety work refusals, complaints, we'll file charges where necessary.
What we want to do is have, not just for the mental health division, but to be able to roll across all sectors, all bargaining units, anybody that's affected by workplace violence, whether it be, again, verbal or physical, because violence is violence. And the tools are there to keep people safe. It's just a matter of getting the resources in people's hands so that way they can go home at the end of the day safe to their loved ones. You know, that's the main goal and objective of this.
There are various things that you can do to get people involved, and some are methods that we've developed over the years, such as participatory action research, getting the workers actually involved in the research. They do the research and looking at their conditions. They get involved in body mapping to indicate where they are injured. They get into hazard mapping to identify where the hazards are in the workplace. And then they have discussions about setting priorities and develop action plans to try to achieve a safer workplace.
We've had a lot of violence in the workplace. We had a severe 2014. We had a stabbing of a co-worker. We were successful, OPSEU, in getting intervenership for the case. So we were successful in getting security guards. We were successful in our employer is giving us 6 days a year of education for health and safety of our choice, which is really huge, we thought. So we brought 2 members here actually to use up some 4 days of that right now, so that's great.
Well, we certainly talk to the members on a regular basis about health and safety. We've engaged with a group to lead a survey, psychological wellness in the workplace, because we believe that the incidences of violence are leading to a real breakdown in our own mental health. So in effect, CAMH is creating their own in-house clients amongst the workers. So we are trying to raise awareness every single day, and we hope that this survey that we're doing on psychological wellness amongst our members brings the agenda to the forefront and forces our employer to listen where they've not listened before.
Briefly, we've forced the employer to sit down with the union and the Occupational Health and Safety Committee to have a third-party risk assessment done, not only for the building but for our clinical services as well.
2 years ago, I really stepped up because one of our nurses was sexually assaulted by a client. And from that, I thought we need to bring awareness to the entire agency because we're a very diverse there's geographical satellite offices that are quite distant from where we are. They have now stepped up to the plate and they are going to be providing staff with CPI training. I've been there 22 years. I've never had CPI training.
A lot of nursing staff still believe that it's part of their job to be struck, to be swore at. It's just part of giving care to people with mental illness. We're trying to get them to see it in a different light, that it is not the fact that they have a right to work in a place that's safe.
If you sit in silence, that's the worst thing you can ever do. You find people that you can relate with at work. If there's different support networks out there, and when all else fails, if you need to, go to a steward. Call your union. That's what we're here for.
My ministry, the Ministry of Labour, have been working with OPSEU to make these facilities as safe as possible. We remain committed to that goal, Speaker. The process is going well. Based on the advice of the table, whatever the recommendations are that the table comes up with, Speaker, we're going to develop a plan to make hospitals safer, mental health facilities safer.
You know, I get asked to sit on a steering committee for a task force called Violence in Healthcare, Ministry of Labour and Ministry of Health. So we've met 4 times. There's some subcommittees been doing some work, gathering more statistics and everything else, and that's all well and good. But I've not seen any action out of that group yet. It is all about austerity, it's all about cuts, it's all about your pathological obsession with a balanced budget by 2018. They say they're going to balance, well that's nice, but guess what? They left a lot of people in the dust.
We are here not to stigmatize people we look after and patients. We want to ensure safety of our staff, our members, and with us being safe, they're safe. And that's a big thing that a mental health division within OPSEU is strive to achieve is to not stigmatize, but to work with and figure out solutions so that way people can go home at the end of the day to their families and their loved ones.